It was the first time ever in the history of our area where we was able to get a whole bunch of people together at one table and talk about the problems of addiction, the problems of opiate overdose and everything else. There's been a lot of things that we've done that we would have never been able to do without the help of RCORP. Project Lazarus really gave us a boost and a go-ahead to find better options to treat. And without their model, we wouldn't really know how to get started.
So in terms of the Lazarus model, the main objective is that, every overdose is preventable and that the community itself is responsible for its own health.
We know that in the African-American population, there's a mistrust. And what we do, we go out and we meet with them on several occasions doing community health screenings and everything else. And we establish a rapport with them to get them to trust us, to let them know that we're here to help them, offer them services that they may not even know that they need.
We have worked with the Pee Dee Indian tribe. We have increased the education with them. It's really about building that relationship and being able to build trust with them and letting them know that we're here for them and we're willing to meet them where they are.
As of today, we have at least 4 or 5 of their members into our program. And whereas before, they was really refusing to accept services from us. So establishing trust in the community, showing them programs and showing them success stories about some of our patients really help bring these different organizations into our care process.
We have counselors in each location within our 5 counties. So we have about 22 behavioral health counselors now made up of licensed social workers, licensed professional counselors, clinical psychologists. We basically see patients of all ages with all diagnoses, even diagnoses for substance use disorder, opioid use disorder, bipolar disorder, depression, anxiety, and things like that. Everywhere that there is a medical provider, there is also a behavioral health counselor available in that office to see those patients for counseling. So with the implementation grants from RCORP, we have been able to really increase our providers. We've increased our medical providers and we've increased our behavioral health providers. And we've also increased providers within the school-based system. And we've also been able to increase education by hiring education coordinators to get out in the community to work with our community outreach team, provide education within our communities. We do community events to provide education.
We really appreciate the opportunity that was afforded to us by RCORP with the funding and everything, because without them, we would be really behind the 8 ball.
We have the medication-assisted treatment program. One of the requirements for the program is that the patients engage in behavioral health counseling along with getting their medications and their weekly or monthly drug screenings and all of the services that we provide for them. We really focus on the prevention and the treatment and the sustained recovery. So behavioral health providers are really in all of that.